people don't always tell you they don't want to hire you because you're Black. They can ask questions to let you know that you may not fit their bill.
Hi everyone, I'm Erica Domingo, a trial attorney here at Grungo, Colarulo and host of the Toxic Workplace Report. Each week on the TWR, we bring you stories of workplaces gone wild, companies that are not quite getting it right when it comes to discrimination and harassment in the workplace. But here on the Workplace Antidote, our goal is just the opposite, to bring you stories about people who are trying to make their workplaces better, striving for diversity, equity, and inclusion in their workplaces, and working to rid them of toxicity. So with that, I'm happy to introduce my first guest, Wendy Lewis, the CEO of the Parkinson Council in Philadelphia.
Thank you so much for being on today.
Thank you for having me.
So,
have you ever faced any kind of discrimination or harassment in the workplace?
Yes, I have.
Is there any specific story or example you're willing to share with our listeners today?
Well, I grew up in the South, and sometimes discrimination or racism can be both very blatant, and sometimes it can be very subtle. So I do know, as a woman of color, that of the Parkinson Council, I know that we have to be very open to the differences that people experience because they have a chronic disease. And so that's always top of mind whenever I'm actually dealing with someone, or actually even in sharing my own experience in dealing with discrimination. Because disability, a person of color, a woman, when you talk about discrimination, it runs the gamut. So I actually had experienced it from the perspective of someone who actually was looking for it. There you go. So when I was in college, I did an internship, and we had to go through some records of a company that was charged with employment discrimination. And one of the things we saw right off in looking at applications of things indicating what the race of that particular applicant was. And when I saw the number of people of color, which was non-existent in the administrative office of the company, I knew right away that they had a problem. And as an organization who was investigating, or part of an organization who was investigating, we also had a problem in how we convey that they were not doing what they were supposed to do legally. So that end of it, I saw blatantly that was happening. From a personal point of view, having, again, grown up in the South, there's, little things they don't necessarily always tell you that they're not going to hire you because you're a person of color or a woman, but they will ask questions to indicate that they're only interested in someone who is not a person of color or a man, not a woman. They'll ask questions about, can you list things? Or you have the ability to list? What about kids? Do you have children at home? Things I'm sure they never will ask a guy.
And they can't ask those questions anymore, but when you were growing up,
anymore.
Yep.
They could ask those questions, not a problem. It's just, it's a far cry from actually growing up in the South, where people can actually do that to your face. And now where folks and companies like yours investigate that kind of thing, that kind of behavior. So for me, it's both, subtle and blatant, but, people don't always tell you they don't want to hire you because you're Black. They can ask questions to let you know that you may not fit their bill. So.
Absolutely. And that's part of what makes my job difficult at times, is people have gotten more savvy about discrimination and making it, finding a reason that is not discriminatory, what we call a legitimate business reason for the action they took, even though there probably is some underlying discrimination involved in their decisions.
Right, exactly.
So having experienced that both personally and professionally, and seeing that in your workplace, has that had an impact on your career and the path that you've chosen, or how you work in the workplace?
Yeah, it actually has. It did change my career path. I decided after undergrad that I wanted to make a change in my life, and told my dad after seeing all the injustices that were happening in front of the South African embassy related to the apartheid struggle, that I was going to go move to DC and get arrested in front of the South African embassy. And my dad was like, "Oh, great, that's exactly what you should do with your career and your degree." Fortunately, I actually ended up working for the man who wrote sanctions against South Africa. And so that was a very serendipitous turn of events. I mean, social justice, I grew up with that in my family. When I was in high school, my school was, I went to a school that was all Black. Actually, growing up in the South, it's not unusual to see an all Black school and see some of the teachers not all Black. The teachers that were all Black were very, very highly rated, PhDs. They couldn't teach at the local schools, local universities, because they were Black, but they taught at the local level, the public schools. And so I grew up in a school system that was segregated. And so, but the teachers had a clear sense of justice. And, my parents had that as well. And so I decided to make that move to DC, and I did. And it was one of the best things I'd ever done in my career. And so working for the person who worked really hard on an international level to eliminate apartheid and apartheid laws in South Africa was just a highlight of my professional career that made me do more to work in the social justice space.
And part of that is now in your role with the Parkinson Council as the CEO. So what are you doing specifically with regard to the workplace at the Parkinson Council? And I know it's a small not-for-profit organization, but you have a relatively big board. So what are you doing to encourage diversity, social justice issues within, the council?
I think the biggest piece for me over the last, I've been a part of the council, it'll be 11 years next month. I think the biggest piece for me last year, the most eye-opening, awakening piece for both me and the board, I think, was the George Floyd murder last year. And I think it opened the eyes of a lot of folks about what people of color have had to struggle to do, and in order to be seen and to be heard. So I think that it just spurred in me that sense of social justice that I've always had, to really be more vocal about our role into ensuring that populations that don't necessarily look like us, or that they have a different kind of experience relating to this particular disease, Parkinson. So for the biggest thing that I've done is to try to ensure that the board understands that there is a whole community of folks out there that are not seen, not heard, or underrepresented. This is what we should be, spending some time doing, and actually educating ourselves about the community as well. And also to provide opportunities for the community and us to build trust amongst each other. So I think the biggest piece of it is that, while we can, put a lot of programs and services out there for people of color, unless they feel are trusting the source of those programs and services, it won't be in a relationship that will last long. We want to make it sustainable. We want to make where both we learn something, and then they also learn something about themselves, about the community in which we all reside in the Philadelphia area. So my goal is to continue to bring up those issues with the board if I can, bring the issues up with the providers if I can, and letting the providers know. And I think they are aware of the disparities that have happened in this particular disease. If you got 44% of the population that is a population of color, and only 8% of the population are sitting in the waiting room, that is clearly something that we need to touch on and focus on. So that's one of the things we're doing.
And that's an important statistic I was going to bring up in full disclosure to our audience. So I am on the board of the Parkinson Council. That's how Wendy and I know each other. But it's been very eye-opening for me to see that, like you said, 44% of people in Philadelphia are people of color, and only 8% going to these specialists at the big institutions, Penn, Jefferson, Cooper, are people of color. And that's a significant disparity. And can you tell us a little bit about how you're actually building that? I know it's not a workplace situation, but the program that you're working on with a lot of these doctors in the region. I know it's called Diversity PD, but if you could tell everybody a little bit about what that is and how that's trying to make a difference to make inroads with communities of color so that they can be reached in this whole social justice piece we've been talking about.
Great. Yeah, so it really kind of started in the workplace of those providers, quite frankly. They actually looked around and said, hey, what are we doing? We could be doing more. And those providers decided that, to bring, the Parkinson Council along to help work through this process. And so we became one of the founding members of a group called Diversity PD. It's called Delaware Valley Endeavor for Racial Solidarity in Parkinson's. I know it's a mouthful. Diversity PD is a lot easier to say. And so we had actually started right after the George Floyd, the social justice movements that happened after the George Floyd murder. And so when they decided to meet, they were very intentional about bringing their institutions along in this process. They actually admitted that their companies, their groups, their institutions, the big ones, hadn't done enough. And so they, not to say they were rogue in how they did this, but they were very, again, intentional about bringing together all of the centers, Parkinson's disease centers in the area and movement disorder centers in the area, putting aside any turf issues, any issues related to competition, because they really wanted to get more granular related to the community that we need to be looking at and focusing on and serving. And so that work, it started with their workplace when they looked around, and then bringing me on, which I totally recognized that from talking to folks on the phone and talking to different communities. I know what exists and what people are lost for where to go. And, it's not just the barriers to care, but it's barriers to other things in their lives that they have. There's barriers to like food. There's barriers to like transportation. This is how this community that we're trying to reach is living. And so the goal of this was to provide education resources and barrier-free or eliminate barriers to treatment and create a pathway to a more comprehensive approach to Parkinson's disease for this community. And so it's not just being a movement disorder specialist, it's also talking to a therapist or a social worker to help you navigate some of those things related to either insurance or family issues. It's also talking to and having a member of your team from physical therapy and occupational therapy and speech pathology who can help you with all the other things that Parkinson's that may be non-motor related, that can bring that team together to work and provide this more essential quality of life program that everyone should be entitled to, no matter whether they can pay for it or not. So that's where we're going with that, and it is something that I really I love this work. It goes back and falls back on my sort of social justice piece and equity and inclusion. I know everybody, it's the buzzword everybody likes to use, but if you can talk the talk, walk the walk, you got to walk the walk. And so I think that this is a group who is actually really, really working to walk that walk.
I love that. And I love how you tied it in that, this is their workplace as these doctors saw, hey, our patients don't reflect this population, and where's the barrier, and trying to work through that to bring equity in healthcare. That's such an important thing, not just with the Parkinson's community, but lots of communities, for communities of color, all kinds of healthcare. So that's such an awesome issue. And I'm so thankful to be a part of it as part of the Parkinson Council. And I also wanted to let you know that the GC Giving Back Foundation, our charitable foundation, has chosen the Parkinson Council as our October cause. We will hopefully be joining for the Walk to Stamp Out Parkinson's, but most of our listeners won't know what that is. So why don't you tell them about the 20th annual Walk to Stamp Out Parkinson's? I love this walk. This walk is all about community. And in fact, our logo this year is empowering community. For 20 years, we've done this, right? So our Walk to Stamp Out Parkinson's is the largest grassroots regional walk, I would say gathering, in the area, that includes people with Parkinson's, care partners, other family members, professionals, healthcare advocates, all there on this day
to celebrate the resilience and the hard work of people living with Parkinson's to come together. So it's a fundraising, but also an awareness raising event. It is so community-based and so community-focused that we actually have folks who are part of the community on the committee, which is really great to hear their voices and make sure that they're being heard, and they're helping to organize the event itself. So it is something that we feel, from our humble beginnings, we feel that has helped our investments in community. So the goal of the walk is to raise funds. It's raised local, it stays local. Money is reinvested back in the communities for programs and services we all, become they're vital ones that become dependent on. Anything from, having a social worker, or having a art program, or having a yoga instructor, or having a doctor doing, creating a clinical, an app through a clinical research project to make sure they're measuring apathy with people living with Parkinson. So it goes the gamut in research. That's a big piece for a lot of folks as well. So we're very fortunate to be living in an area which we have all these experts who are willing to do and could do all of these amazing things with the dollars that we raise at this event. It's our biggest fundraising event of the year. We're very, when I see the people in their faces and they're walking or they're rolling, they're there. And so they are there to support each other. And it's almost like a big homecoming every year, and so people love seeing each other and being back at the zoo, and then being virtual for those who are less, comfortable with being in that environment. I think, all that we do is continue to build community. 20 years is a long time for any event. We started off with raising $600. This year, our goal is to raise more than the goal of $275,000. We'd like to raise more than that. And we hope folks come out and support, register, donate, join a team, create a team. So this is October 16th, Philadelphia Zoo, and also on Zoom. So
I'm glad you got to that. Yes, October 16th, Philadelphia Zoo. Last year we had to do it all virtual, so it's really exciting to be back in the zoo. It's such a fun day. There's a lot of good stuff going on at the zoo.
Fun.
Plus, you get to hang out at the zoo all day if you want. It gets you into the zoo for the day.
Yes.
And what a fun place to be, the Philadelphia Zoo with all the animals, just waking up in the morning before the zoo opens. It's a really incredible experience. And like you said, it's all about that piece about community. So I appreciate everything that you are doing, everything the Parkinson Council is doing in that social justice piece, that equity, inclusion, all the buzzwords, but you really are walking the walk, Wendy Lewis. And thank you so much for being here with me today.
Thank you. Thank you for having me.
Many thanks to Wendy Lewis for being my first guest here on the Workplace Antidote. Let us know what you think, and if there's anyone you think we should be highlighting who's getting it right in their workplace. And be sure to check back so you can catch the next one.